Hello and welcome to the While You Wait podcast. We bring you stories of humanity, care, and hope from across the Arkansas healthcare landscape. Our series is hosted by the staff of the Arkansas Behavioral Health Network, a local nonprofit dedicated to better health for all through integration. I'm your host, Kim Schuler. I'm also the CEO for the Arkansas Behavioral Health Integration Network. I'm so glad you're listening today. On today's episode, we're going to explore the topic of language and access to care. Language can stand as a social determinant on its own, but we need to explore how closely tied language is with culture and different understandings of behavioral health, treatment, and stigma. To discuss this today, we've invited Dr. Carlos Acosta and Katiutschka Reyes, who are both Arkansas-based medical providers, and they know what it's like to speak another language in this healthcare landscape. We'll get to that in just a moment, but we want you to know that we are a new podcast, so please remember to subscribe and share wherever you get your podcasts. Also, feel free to drop us a note at www.avennetwork.org for any feedback, questions, or episode suggestions. Well, now that housekeeping is done, we're going to get started with the episode. I'm so excited to be here with today's guest on the While You Wait podcast. We have Dr. Carlos Acosta and we have Katiutschka Reyes. And so I'm going to ask them to just give us a little bit of a brief introduction to tell us what their current role in the healthcare space is. And then we'll ask them to talk about something a little easier, a little fun, maybe some hobbies, things that they enjoy doing outside of their work time. So Dr. Acosta.
Yeah, glad to start. So Carlos Acosta, I'm a family physician, currently working at the University of Arkansas, Paul Walker Health Center, and we take care of anybody in the university community here in Fayetteville. And I've been there for a little bit over 10 years, full-time. I work part-time at community clinic here locally as well until about 3 years ago. So that is what I do right now. Originally from Colombia in South America, and I think that's why I'm here, because I speak another language.
Absolutely. And how old were you when you moved here?
I was 17, so I moved, I finished high school in Colombia, and then I moved here for college, and then one thing led to another, and now, I work here, I'm married, have 3 kids and 2 dogs.
Okay, awesome.
So yeah, lots of steps in between. But yeah, 17 moved here.
17 moved here. Fantastic. And so is Spanish your native language?
That is correct, yes.
Okay, wonderful. And tell us a little bit about hobbies, things you like to do when you're not in the office.
Yes, Kim. So hopefully you caught the part. 3 kids and 2 dogs. So hobbies are... No, they... most hobbies tend to revolve around what are we doing? Are we doing basketball? Are we doing baseball? Are we doing softball? Are we doing soccer? We do love board games, so I would say that's a hobby.
Oh, fun.
So what I found is it's key. Teach your kids to like the things that you like. So then as they grow, then you have an excuse to do them. So I love board games, so we get to play board games.
Okay. That's great advice and good to know. So, wow, 3 children. I remember when you were having your first, and we were having the baby shower for you at community clinic. So
yes, wow. We still remember that. So yeah, thank you all for that. It is exciting. Yes.
Wonderful.
Yes.
Well, we are so glad you're here, and we can't wait to talk a little bit more with you about language and how language can affect healthcare and our experiences in healthcare. And we also have with us Katiutschka Reyes. And Katiutschka is a great friend of mine, and I'm so glad you're here with us today. I'm going to let you introduce yourself, tell us a little bit about yourself, what you do in the healthcare space, and then some hobbies.
Thank you, Kim, for having me here today. So I am from Ecuador. I came here when I was 20 years old with my two kids, and I decided to go into the nursing profession because I had a great mentor, Betty Battenfield. So I went to the U of A. I did my undergraduate, and in the meantime, I work as an interpreter and translator for the dialysis clinic here in Fayetteville, Springdale Rogers, and Siloam Springs while I was in school. Then I graduated from the U of A and I started working at the community clinic in Springdale as a floor nurse. And then I became a clinical manager for several of them. And then while doing that, I went back to school. I went to UMS in Little Rock and I did my family nurse practitioner. And then after that, I started working. I have 11 years working with endocrinology for Mercy.
Wow. So a long, long time you've been in the healthcare space.
Mm-hmm.
And so tell us a little bit about hobbies, things you like to do for fun.
Well, my kids are grown up and gone, so I can do whatever I want, I think. We all share the same things, We are very outdoors. We like hiking. I share with my son, Pablo, passion for gardening. He's doing that. And with my daughter, Nicole, I share art. We like a lot of going to see museums, plays. Personally, now I like to hike. I practice Tai Chi. I do yoga. And recently I have started doing meditation a little bit more often. I start listening to a podcast called 10% Happier before COVID. And then during COVID, that was my company. And then now I have practicing more, and I have a group that I meet once a week, and we do some meditation.
Awesome. So one of the things that I hear in your free time and hobbies, in addition to gardening and hobbies, is meditation and some self-care.
Mm-hmm.
So I can't wait to talk a little bit more about those pieces.
Sure.
Because those are essential pieces of our health. And so it's wonderful. And I can't wait to get your thoughts about that. So we'll continue and talk a little bit more about that as we get into this conversation. So one of the things that I think is important is when we're working with patients, language is such a critical part of the healthcare visit. And sometimes language barriers arise when the patient and the provider do not share the same native language. And patients who do not speak the local language are disadvantaged in terms of access to healthcare services. Um, Sometimes feeling like they might not get equal treatment or have the same types of health outcomes. Language barriers directly impact the quality of the health care that patients receive by reducing communication and satisfaction. So, with that, I just wanted to ask you guys your opinion on language and how language affects patients when you're seeing patients as well as their experience. So, do you think language is affecting the visit when you're interacting with the patients?
Sure, it does. Tremendously. When a patient comes to see you and they are in the room, I think they are in the most vulnerable spot. You're going to learn many, many things about personal and their health. And then if you cannot communicate, they cannot communicate with you, their symptoms or feelings or situations, you cannot help. I think it's very important to have that communication between the patient and the provider to help them understand. It's not just the language. I think it's also the culture, understanding their background. So when you come up with a plan, it's kind of you adapt it to their situation at that moment.
Absolutely. So, what I'm hearing, it's not just language, but culture and understanding that patient where they come from and understanding um, some of the challenges that they
Mhm.
might be facing.
Yeah, it's important. It's you can start specifically. For some patients, medicine, taking medication is not part of their culture, right? So you kind of had to learn how to gain their trust and explain things. I think a lot of things come through education and explaining what are these medications for, or what you want to do these, so that way they can process that and understand it. The same thing, for example, when you're talking about diet, what I eat, what you eat, or what you eat is completely different. Doesn't mean it's bad. It's just it's different. So you had to adjust that, I think, to their culture. So you don't put more pressure on that. Like, oh my gosh, now she's asking me to eat this, but I never had eaten this. Where do I go get this? How do I cook this? So I think we had to do as a providers a little bit of job ahead to kind of know more about their culture. So when we talk about a change in diet, we can't kind of go with what they're eating, or take the time to ask them, tell me about your diet, tell me what you eat, for that matter.
Absolutely. Those are great points. I want to give you an opportunity, Dr. Costa, to add to that. Do you have any thoughts or want to respond?
Man, that was so good. I'm not sure I can add much. I mean, it's key. Language is so important, and I have to remind myself that I read this somewhere that what you say is important, obviously, but how you say it also matters quite a bit. And I think we learned with COVID a lot of. One is super important what to say because there were so many just wrong things that were shared. But oh my goodness, how to say it is also so important. Because even if you are saying the right message with the very wrong condescending tone, it's not well received. And actually often can push people the other way. So I think in a more global way, language, even if we're all native speakers of the same language, just the how, like Katiutschka was saying, the ability to build rapport and how to essentially try to understand where your patient is at and explain things in a way that are relatable to them. It's key. So there's lots of pieces there. But yeah, I basically agree with everything Katiutschka said, and just the how is at least as important as the what. In a lot of cases, not always, but often.
And also to add to what you're saying, it's also your posture, your tone of voice, how you look at them, your body language also speaks so much more than what you're conveying verbally. All of that, I think, has a very important role where you're trying to build trust with the patient, for that matter.
Absolutely. So one of the things that I heard you say, and I think that I'm curious, you said it's important that we understand the culture. Let me ask, in the current work that you're doing, are you seeing patients that are speaking different languages and from different cultures?
Yes, I have. I seen them. So that becomes a challenge, because that's not my language. But I do understand, and we both understand that we don't speak the same language. And there's such a connection, I think, that the other person understands that I don't talk there, and they know that. So I think it becomes, I don't know what it is, but it becomes a little bit easier to convey the information, because I think they're seeing that you're making effort, to communicate with them, either to interpreter services, or most of the time they have a family member, but you also need to make sure that the family member is understanding what you're saying, because if not, there's nothing there to be communicated. Sometimes writing them down helps. Or if you can find a website that you can translate some instructions, that will also help. Pictures helps too. And also, don't assume that when they're not in their head, it means, yes, I understand you, because that's not the case.
Absolutely. Um, what about you, Dr. Acosta, with your work? Have you
Yeah,
seen patients that don't speak the same language,
yeah.
and thoughts, strategies, techniques that you might try to use when you're trying to communicate with them?
So over at the university, we do have lots of people from different countries. Most of them will have um, at least enough English knowledge that we can speak. But I think the culture aspect that Katiushka mentioned earlier is really important. And also what Katiushka mentioned earlier, just making the patient feel just valued and respected and appreciated, I think that goes a long way. Um, it is such a vulnerable situation when you walk in. I mean, I think all of us. I I really don't like going to the dentist, so I won't tell you the last time I went. But it's.
We won't ask
I
you
know.
today either.
Who is your dentist?
Yeah, exactly. Yeah, my wife gets on me for that often. But no, it's scary. You go in and you have no idea what they're gonna tell me. I need a crown. I need a root canal. I don't, by the way. At least not the last time I did. But do I? And how much is this gonna cost? So I mean, and I have dental insurance, and and thank God that we can afford things for the most part. But it's like, is this gonna be like a $2,000 procedure type of thing? And what so it is. I think we've all had experiences where you go into an office for something clinical, and it is scary. And that is, I mean, even with a certain degree of comfort with the language and culture, it's still scary. Just because there are so many unknowns in relation to diagnoses, but also cost and just how the system works. So just putting somebody at ease and being friendly and being respectful. An example from a patient today that I saw that um, we were talking, was seeing them for some GI issues, some gastrointestinal distress, and then they said, and I'm fasting for Ramadan, and just something as simple as saying, oh, Ramadan, that started March 11th, didn't it? And that for to them it's just like, oh, he actually even knows what Ramadan is. I'm not Muslim. I probably don't share a whole lot of things related to religion, but I care enough to know, yeah, I understand that is a really, really important holy month, and I get it. I understand, what is going on with that. So just the fact that I was able to say that and say, okay, I kind of get a little bit what you're doing. Let's talk about what this looks like for you today. That provides just that rapport. So finding, we're all humans. We all have something in common. Well, at least most of us have something in common with somebody. So trying to find a little bit of that. I growing up in a different country, like a lot of my patients like soccer, but not all of them. Sometimes I'll be like, "Oh, you're from so and so country, and you like you're from Argentina. You like Messi." And I remember this patient was like, "I don't really like soccer." Okay, so yeah, you like steak. I like steak. And he actually did like steak, so we talk about grilling steaks. So that was good. Um, so finding some point of, let's remove this crazy barrier that we're both humans having a conversation, and really you're here because you have something to tell me that hopefully I can provide some insight for you. And I think that's where language really matters, because in medicine a lot of times the history is what matters a whole lot, especially in a clinic setting. Once you're in a hospital, it's a little different. But in a clinic setting, yeah, the history, as Katiutschka was saying, is what matters a lot. Like, okay, let's talk about what you're eating. If you're eating 10 tortillas 3 times a day, okay, that is maybe not the best for your blood sugars. But if we don't take the time to ask and make that patient comfortable to tell you what's actually going on, I know all of us that have kids it's just easier to say what the other person wants you to say. It's like, okay, I want to get you off my back, so here's the answer that I think you want to hear, so we can just move on. Um, but as you kind of develop comfort with somebody, hopefully you can have an honest and actual good conversation.
So, what I hear, part of my takeaway from what I'm hearing you say is language is important. And I think both of you conveyed this. Language is important, but language and words are not the essential piece of that visit. If you can connect with people over some commonality, if you could develop a relationship, if you can start to build that foundation of trust, and you do that through nonverbal communication as well, then you're getting your message uh, to them in a different way than just by using words. Is that accurate?
Yeah,
Mhm.
I wish you could just interpret everything I say all the time, Kim. Just put it into better words. Yes, I would say that that is accurate.
Okay. No, wonderful. Because one of the things, um, and I have to say, I've talked to a lot of different providers, and I actually talked to Katiutschka briefly about this last week about the importance of trust, and we have to trust the person because just like you referenced, we're going into the dentist and we're scared and we're waiting to have that exam and we're waiting to hear, what are the results? Do I need the crown today? Or is it just x-rays and a cleaning? Is similar when we're coming in to see our primary care providers or our specialty health providers. And so could you talk a little bit about any techniques or strategies you might use in order to help patients feel more at ease, more comfortable?
I think one of the things, part of the trust to me is also you start by listening. Listening plays a key role, because you have to listen not just with your ears. Um, and listen what the patient is trying to convey to you. Where are their questions? What they don't know, uh, kind of anticipate so that way you can put them at ease by answering all those questions for them. So I think when you see that you are being honest and explaining things, showing things, they see or they can perceive that you really care, that you're really there to help. And sometimes that helps them to open up more to you, and you establish what I call, I knock on the door once and you don't answer, and then I knock on your door again and you don't answer, but I know by the third time you might open the door and let me be part of that, and then I can help you with what you need because you are trusting me. Because you're putting your health on my hands, so this is very important, to show that to patients. There is not just one more patient in the room that comes in for 10, 15 minutes and goes out, that during that time you are showing that you care and you're going to try to find a way to help them somehow.
Thank you, Katishka. Um, Dr. Acosta, any thoughts about techniques or strategies that you're using when trying to establish that initial trust and
Yeah,
connection?
I think nothing is more important than actually caring, and I think most people are intuitive enough to tell. So actually try to care about the patients that you're seeing. And I know it's on long days it can be a little harder. But one simple thing is, if it's somebody you've seen before, just find something in the chart that you can refer to from before. So just like write a little note that, oh hey, I saw. I mean, an easy one is you were gonna have a baby last 6 months ago. Okay, well that's relevant to the medical visit, but also how's the baby? Or if, I often ask if we're close to breaks, what are you going to do for blank break? What are you going to do for Thanksgiving, for the Christmas break? Or then when I see the next, I just ask, oh, how was blank break? Or just like one little thing that you can just note in the chart that will, something you can bring up to say, okay, yes, we're here for business. We're going to talk about whatever the clinical the reason you're here for the visit. You're not here to see me to just hang out. Um, but and it helps me also to have a little frame of the person of saying, oh, and you got a new dog, last summer. How is the new dog? And then maybe that will say the dog died, and now you have depression, and that's why you're here. But then, but just ask about the little dog. So I'll say that's something easy. If it's the first time you're seeing the patient, a lot of times they will fill out a lot of history, even before they see you. So look through there to something that maybe is not directly related to the visit, that you can still show interest in. And that could be an easy one is if they put any type of interest or something that is disarming. That most of us, if somebody shows interest in something we like, we're gonna talk about it. And so try to find something that, and if you've seen them before, that you can relate to, or if it's the first time, find, if they already fill out a history, try to find one thing in there Anything you can say, oh, and I see that, you lived in India for 10 years. How was that? What was that all about?
It is amazing what you're saying to see when you remember something about them, something personal they shared with you 3 months ago, 6 months ago, and you go back and say, hey, you're going to do something. How did it go? And they look at you, how do you know? Well, you talk to me about it. So tell me, how did it go? How was it? So they like that, because they see, okay, so the listening is there. They know that she's listening. Even it wasn't nothing medical, it was something sociable that they were doing, or personal. So they say, oh, the listening is there. So I think that's also what helps with the trust for them to see that it's not just caring just for the medical aspect, or their health. You see other stuff in them. You see them as a human. They're not here because they are a chronic condition. They're here because they're a human, and a human has so many dimensions. It's not just your diagnosis. You are not your diagnosis. You are your name.
Actually, so I hear you saying you see them as the person they are,
Mhm.
and then they're bringing in these different health symptoms.
Sure, because sometimes they already feel defeated because they have been, classified with, I'm going to say, hypertension, and then they think that's what they are. They're not that, they have a name, they're Kim, they're Carlos, they're Katiutschka. So we're humans, and we bring that into the table. So I think recognizing that and making sure they understand that that's who they are, not what they have, that doesn't, I think, makes them kind of see better a little bit, or try to do a different perspective of how to treat this chronic condition, for that matter.
Absolutely. One of the things that I heard you say that I think is so important is you said you have to listen to someone, and you have to listen to them not just with your ears. My guess is you're listening to them, and I am guessing, but you're listening with your heart, and you're listening with your eyes. And
Exactly, with the touch, you can listen when you touch a person, when you say hello, when you shake hands. You can feel the ease when you put the hands on the back and say, hey, Carlos, how are you doing? I haven't seen you for 6 months. You know, the person ease up, it's kind of relaxes. So then it's good because then we can have a conversation. But if the person is all stressed out, sitting there, giving you eye contact, their shoulders are hunched over, they're kind of protecting themselves, their hands, all of that. So that's, to me, is listening. From the moment you open the door, but you're looking at the person and you exactly know which state they are. And that helps us to come up with how am I going to approach it? What do I need to do? Do I need to go back and talk about something you did 3 months ago? Do I need to talk about something that happened on the news, or something that happened even to me? Because also sharing helps with the trust, that I need to share something with them about me so they can see me as a human too, for that matter.
absolutely, absolutely. One of the things, and just wanted to share this, as I was looking at some information getting ready for today, I read this, and I think it really speaks to what we've just been talking about. It said the AMA Journal of Ethics exclaimed that physicians need to understand that the health world is a foreign country to many Americans, and we need to pay closer attention to understanding the language patients use and how they draw meaning from what they hear. As I think about that as a healthcare consumer, healthcare is a foreign country, and I can relate to some things that I heard you all say, but we're in vulnerable positions as health consumers. It's a foreign world. It's different than our everyday experiences, and sometimes we're probably, and I'll speak for myself, um, I'm anxious, and sometimes I'm scared when I'm coming in, um, and if I didn't speak the language, that could just contribute to those feelings of um, what's going to happen today? What's this experience going to be like? Is my provider going to understand me? How am I going to communicate to them what I need to communicate? Um, thoughts on, so let me pause there and ask thoughts on challenges that patients are experiencing when they're coming in trying to use words to describe um, what's going on, and does language affect?
It is a different language, and I think a little bit with that. So I think I see two pieces, and you can fill in, Kim, if I'm not hearing you correctly. But one is the patient coming in trying to put words to maybe things that they're not sure about, and some of that will be there's so much information out there, and this is a challenge for us as well. Is so much information is hard to keep up, and somebody will read something that they will say, "Oh, but so and so, I read this here that this is gonna kill us all." It's like, well, okay. So then trying to understand, okay, where are they coming from? Like, what is the actual issue? Then the other one is, like I was saying earlier, how you present information is just as important as to what. So with the first one, I mean, an example, and it all goes back to just communication, taking a second. A lot of times we're so rushed. We're taking a second to just actually listen and say, I say this all the time. Let's just back up, because people will come in and they will say 25 things in 10 seconds. It's like, all right, so let's back up. So, usually by the time we're seeing them, a medical assistant will have taken a little chief complaint. I will say, so this is what it said here. What I'm hearing right now, a lot of what you're doing right now is saying what I'm hearing you say. So it sounds like here it said that maybe you were coming in because you were having a cough, but really talking about some other things. Sounds like you're having some stomach issues and a headache, and then you had a trip, and then maybe you were throwing up a few days ago. So let's back up. So what started when? And then people take a breath, because they know they don't have to tell you everything in 5 seconds. Now they know, okay, he's actually or she's actually listening. Let me think, why am I even here? Okay, here's why I'm here. A week ago, I started to feel sick with some sore throat, with a headache, and then that got better, and now I've been throwing up for 3 days. And I think, and often people know why they're there, and I think it's actually because I took this medicine that I probably should not have taken, and it wasn't even medicine. It was some weird thing that here's the name of it, and we look it up, and it's like, oh my goodness, yeah, you should not have taken that. So and all it took was like, okay, let's just take a second and let's walk it back. What started when and what's been going on, and and I think the theme again is communication and being able to give the patient empower them to say what's going on, and the freedom to know that, hey, you don't have to say everything in 5 seconds. Why are you here? Now, when somebody brings like a list with 20 problems, we do have to say, I am so sorry. Let's pick 3 of those. What are the most important ones? Because we do have other patients that are going to be very, very mad if we talk about all 20. But even that is different. It's saying, hey, I'm going to listen to what's important to you today. And then with that, Kim, even with all that, often at the end of the visit, as you're ready to walk out the door, they say, and by the way, and then the actual reason why they came in comes up. So it took the whole visit to talk around something that they were just building up the courage to share. And then at the end, it's like, okay, and they say, this is actually, I've noticed this, and it's something that would say, okay, well, that's why we're here. All right, let's talk about it. So what do you mean? What do you mean by that? And then you go into that conversation. So did that answer some of your question?
That did.
I was going to add, one of the challenges is also the comprehension of the medical terminology that we use, with patients. So to me, that's a challenge sometimes, because even though they read the lab, they saw a diagnosis, they do not understand because they had not been taught, what is this? What is having hypertension? What is having heart failure? What is having diabetes? So that's to me a barrier, because in order for them to comprehend the importance of the treatment, the importance of the steps that you're asking the patient to take, they need to understand. It's not just saying. And so to me, that's also, it's not that we're talking not even the same language sometimes, could be different language or the same language, but if you don't educate them, and let them understand what it is, then I think they cannot process it and then, move forward. Like I say, with the treatment or changes that they need to make to accomplish a good goal on their chronic conditions for that matter.
That's such a great point. I want to follow up and ask specifically when patients who speak Spanish are coming in, are you seeing patients in their native language? Are you speaking to patients in their native language?
When they speak Spanish, yes, it's kind of one of the funny things, they see my name and my last name. And so the first question is they don't talk to me in Spanish. They look at my face and say, so, name is not from here. It's not Hispanic. Maybe your last name is Hispanic, but I'm looking at you. You don't look Hispanic. So, and I break the ice and say, I do speak Spanish. And then you feel the ease, on them for that matter. But yeah, I do. I do speak to them in Spanish. And sometimes they're patients that want to practice their English. And I say, sure, let's go with the English. And then sometimes it's halfway English, halfway Spanish, whatever you feel comfortable to talk. Because sometimes symptoms can come easily in one language than in the other one. And English could be something different that they want to use. So it's okay.
I love that because a lot of times we'll say, meet the patient where they are, and even with the language, right?
Mm-hmm.
So that's great to hear. And knowing that sometimes you're speaking in Spanish, sometimes you're speaking in English, and sometimes it's a combination of both. What about you, Dr. Acosta?
Yeah, always I always assume it's English, so I ask because some people it may have happened before. It's kind of embarrassing that if I misremember someone and I speak Spanish to them, they're like, I don't really speak Spanish. It's like, okay, sorry. So always ask. I always ask, hey, if it's somebody that I haven't met before. And often the medical system will let me know, so they prefer Spanish or not. But um, we start in English, and then it often becomes obvious whether they prefer Spanish or not. And and it's so helpful. Language is so important, and words matter so much. And the word will have such a vivid imagery or meaning behind it for someone that in your native language it actually means something that you would say, like if they say a word and you go, oh, okay, I get it, because you have the same kind of like visceral reaction to like, oh yeah, wow, that's awful. That if it's translated, you would not get that. So I do think speaking in the native language, there's a lot more to it than just an example like bread pan. Like it's not. No, that's maybe not a great example for that, but there's a lot of meaning tied even emotionally sometimes to a word that when it's translated, as the person listening to the translated word, you just miss it. You go, okay, well, I know that this word means that. What's the big deal? Why are you so stressed about this? Whereas if you hear it in your native language, you actually have an emotional response to, oh, yeah, I get it. I see that.
I don't know how it happened to you, but sometimes even we speak Spanish, their words are different where you're coming from.
Yeah.
So that becomes a quite funny conversation because you learn, I learn. What I'm trying to convey to you is not how you say it. So I say, okay, how would you say this? And then you say, oh, I use this word for that. Okay, and I had to remember that word. So next time when you come, that's the word that I use to communicate that to you, not the one that I know on my native language. So I found quite interesting that we even speak Spanish, but we point out to things, foods and things differently, and things too, and so always had to remember, oh, you are from here, oh, I need to tell you this, not that word, and then also they pick on you and say, where are you from, because you're not using the same words. Oh yeah, we're not, so that's quite interesting. So
Different countries have different words that have different meanings and different dialects, and so that's such a great point.
Mm-hmm.
Absolutely. So we can't just assume because someone speaks Spanish that they're going to understand all of the terminology.
And also to let them know that that it's only one country that speaks Spanish. You have so many countries that speak Spanish. So
Absolutely. One of the things that you touched on, Katiushka, and I think is so important, is you talked about health literacy and how to explain specific conditions or treatments um, in a way that patients can understand. I don't know if you could talk a little bit more about that. And do you ever incorporate using their native language to try to help break down specifically symptoms and treatment?
Yeah, so I am always asking you, how do you learn? Because, we don't learn the same way. We're visual, we're auditive, we like to read, or a combination of both. If you explain to me, how did you learn, how did you learn something, then I try to do that. So I'm a very graphic person, drawing or showing a picture, and then I can explain to you, in simple words, how a medication works, so you can understand. And also for diagnosis is the same thing. Kind of, showing you a heart, showing your blood vessels, showing you the plague, kind of give you an idea, even though, you're not seeing it, to see if you can understand what I'm trying to convey so you can learn more about the disease. Handouts usually are good if you can find them in their own language too. And also not just give them the handout. I usually say, here, read this in front of me. Questions, do you understand? And it's, oh no, what is this? And okay, this means this, so that way they have. And then I say, now your homework is to go home and read it. And then if you have questions, let me know, send me a message or call. And if you have more questions for that, or talk to your family. Or sometimes if they bring, a father and mother, or husband and wife, or boyfriends, girlfriends, daughters or sons, I always say, go home and talk about this, go home and check it out and see what you think about it, and then ask me questions as a family, so that way you all understand, because it's very important when you're trying to change a lifestyle on one patient. You had to make the family be part of it, because if not, it doesn't go anywhere, so it's good to involve everybody on it. And then sometimes it's funny because you have the teenagers that talk in English and the adults in Spanish, so you had to go teenager in English, the adults in Spanish. So you go back and forth, because they both want to know what you say, right?
So one of the things that we're hearing is we've talked a lot about communication. Communication's essential, not just using words, but also nonverbal communications. One of the things that the research is showing is if patients are not seeing a provider in their native language, there could be miscommunication and decreased satisfaction in the healthcare experience. Have you all observed that in your experience?
To some degree, a little bit, and I think, but not always. And it's very specific because I've worked with colleagues who are so good at making people feel comfortable and cared for and listened to, that even though the patient is speaking in a different language, they feel cared for and they feel good. But as we know, once you add an interpreter, everything just gets harder. And conveying information in the same native language, like we were just saying, conveying medical information in your same native language is hard enough. Now you're having to convey it in a different language through another person. And as we were saying, even within the big category of Spanish, there are lots of little subcategories that will have different cultural meanings in different places. So, from Mexico to the Patagonia there, I mean, you're going to find, like, I'll have more in common with, I mean, even within a country, like even within the country of Colombia, like I'll have some things a lot more in common with even the way I speak with. We have quite a community of students from Panama, and we're Caribbean, and I've never been to Panama, but when I talk to some of them, it's like, oh, we sound a lot alike. We sound even more alike than I do with somebody from a different part in Colombia. So yes, you're adding layers that will make it more challenging to effectively convey the information that the patient needs to take and internalize. So there's that. There's also the piece of the patient may not feel super comfortable talking through an interpreter to actually, like we were saying, the reason why they're actually there to see you is not any of the first three things that they're talking to you about. It's actually the fourth thing that they may never get to with an interpreter in the room, and then you running out of the room. So I can see that I would not say that it's always the case, and I have definitely friends who are very, very good and are able to use an interpreter, okay, but it's definitely harder and definitely more challenging.
Do you think it takes more time when you're using an interpreter?
Yeah, I mean, it should, and I think it should take more time. I don't know that it always does, because again, you may never get to point four. You stop at point three. So I find that I always take a long time because people often want to like talk about. They're like, oh, finally somebody speaks Spanish. I get to talk about like the things from the last 30 years I haven't gotten to talk to anybody about. It's like, oh yes, awesome. Okay, let's unpack this. It should take more time. I don't know that it always does.
Well, I think it's kind of the same as Carlos is saying, you know. It can be, it's not always the same way. And then I think as long as the patient sees you're making the effort to communicate in their language, I think that's a value that you add to that. And I'm pretty sure other providers also use other ways of communicating. You know, they can print things from the EMR that are in their own language, you know, and go over them. Um, but I think everybody can do it, you know, because if we see people that don't speak Spanish and speaks not English but another language, and you always find a ways to communicate, there's always ways that you can help with that. I think it's just it takes time.
Yeah. So again, building on that relationship.
Yes, doing this, yeah, showing that you're caring, you're honestly caring, you know, meeting them where they need their needs.
I think that's such an important point as we're having this conversation is that we all have personal biases. And so, if we could be aware of those blind spots, I think that's absolutely critical. And not only will we benefit in our families and spouses benefit, but also our patients that we're serving.
Yeah, and can I say that that's one thing that I think is also a lot better in medicine right now is it, not blaming patients. Like a lot of times you'd be like, oh, they're just not doing this, and not having like sometimes you'll see somebody with a specific problem and you see, oh, obviously they're not taking their medicine. They're not. It's like that is at least as far as I can tell, it's not quite as prevalent. It's more of a okay, why? Obviously our treatment plan is not working. Now sometimes it is because people are not taking their medicine, but why? We can't afford it, or maybe I did not explain well. Really, here's why we have to take this medicine, or I did not address. Maybe they did have like every time they took the thing, they had diarrhea for days, and this has happened. Like if I have not set up a relationship where they feel comfortable telling me I took that and I had diarrhea for days, then they just tell me they just won't even bring it up, and they will be on the medical record saying yeah they're taking metformin twice a day, and you ask them, are you taking this medicines? Yes, I am. Okay, but it doesn't look like it. And but the relationship was not there to say no, I'm not taking it because I had this side effect that was terrible. Then you go, oh my goodness, I am so sorry. I wish I'd known that earlier. Here's some other options. um,
So there's always good, you know, when you talk about non-compliance, you know, it's kind of interesting, you know, when you see patients and they say them because they're not compliant. But in reality, I think goes back to the beginning of our conversation. You know, I think trust and listening. You know, because people is just not compliant because they're not compliant. You know, there is always a reason behind. If you take the time to figure that out, you know, in their own language, on a different language, you know, what is causing you from not taking a medication or doing a test or following instructions. That's quite important because that's just, to me, is seeing them as a human, you know. So they could have social issues, emotional issues, you know, work related issues, spiritual issues, you know. And then if they don't meet that, to me, they're never going to be taking the medication or doing the test. So I think sometimes medicine goes beyond prescribing, you know, or ordering tests. It has to be more of trying to understand who you are and what is that you really need at this moment for you to be able to achieve my treatment or my proposal of treatment, on that matter. Also, make them there feel part of the decision. It's not because I say so, it's because I explain this and you compromise. So we both compromise on something and then we move forward, for that matter.
Absolutely. So coming back to that relationship, one of the things that I heard you say is looking at the different aspects of the person, whether that's spiritual, mental health, all of those pieces. Wanted to ask, do you see patients coming in to see you for physical health needs, um, and actually there are underlying mental health issues?
Yes, I think a lot of them sometimes you again take the time and listen, you will realize that the cause of them not taking care or not doing something is because they have a mental health issue that has not been addressed. They might try to say something, but if they are being rushed in and rushed out, they don't say it, or if in their culture is something that is not well received, they might not even want to speak it out. But yes, I mean, that affects a lot. And then, the fact that they feel trust on you, even though you're not seeing them for that condition. But if you listen, and you can say, well, you're not seeing me for this, but I'll find you help. I refer you to behavioral therapy, or if you need medication, I'll refer you to the psychiatrist, if you say, well, I don't have the income, well, let me find what is in the community that I can help you in the meantime. And if it's not that, maybe I always say it's religion. What's your religion? Do you talk to your pastor, priest, or whoever in your, or spiritual too, you do have a friend, you talk to friends, who is the person that you go when you're having issues and see that will help in the meantime. But yes, it plays a big role and impact on them physically, when they cannot accomplish that help with mental health for that matter.
I don't know if either of you have a story or a case that you might be willing to share where you had a patient was coming in for identified physical health issues, but there was a mental health component that was affecting symptoms or ability to get well. And then did culture affect that in any way?
I think you mean like today, because it happens every day. Um,
This is
no,
great.
I mean an easy example is just headaches. How it's so often I will see somebody for headaches, and occasionally it will be something bad, and that's why everybody's worried about. Is something is a tumor, is an aneurysm, is something really bad. But more often than not, it's something behavioral. It is I blame almost everything on sleep. So that's one of my first questions. Well, how are you sleeping? If you deprive somebody from sleep, pretty much they will develop every symptom for everything in the book over time. Um, so headaches is a big one because often it will have a root cause, and people want to know a root cause, right? I think some people just want a pill, and that's fair, but most people want to know, well, why am I having these headaches? And so then taking that additional step of saying, well, let's try to figure out why you're having the headaches. Where does your head hurt? How often does it hurt? Are there any times when it seems to be worse? Um, and often sleep deprivation will lead to that. Often tension, and when you say, "Well, so it's been worse over the last month. Has anything changed in your life as the last month?" People will say, "Oh yeah, this." I've been having more conflict at home or at work, or I'm worried about my family back in my home country that is really struggling. And then the light bulb goes off. It's like, okay, and then what are some things we can do to that? And then if we have a behavioral health person embedded in the clinic, then we can say, let me have you talk to Kim real quick. Um, but no, often headaches is a big one. We see a lot of people with chest symptoms, and I think when we feel strongly, we feel it in the chest frequently, and that can be just palpitations and feeling of heart racing and feeling which to the extreme is feeling of panic. Which basically feeling like you're gonna die, but there's less levels of that where people just feel their heart racing, they feel some tension, and they're coming in because they're having chest pain. You unpack that and peel a few layers away and say, well, when did it start and when is it happening and what's the association? And sometimes it is hard, and I tell them, look, my primary job is to make sure that there's nothing that's gonna kill you here right now, but I don't think that's what's going on. I think really what's going on is X. the timing and it all kind of fits with this really stressful situation you've been dealing with or this other thing. Let's talk a little bit more about that. Um, anyway,
Those are some great examples.
simple.
And one of the things that I heard you say when I asked if you can share an example or a story was this is happening every day.
Yes, yeah, yeah. If you think, headaches, kind of different chest symptoms, and then digestive symptoms, they're such a root, and it's not. And I think one other thing that we're learning that we're becoming really a lot better at is not saying hey, like used to say like, oh, it's in your head that you're having these symptoms. Like it's not. There's actually sure it's in your head as in your brain is like directly
You get the
connected to
signals.
your gut, and there are your brain and your gut are having this interaction that's leading you to having pain and diarrhea or constipation or this mixture of things. Um, so how do we address that? And sometimes it's medicine, often is some other type of behavioral approach to it. The downside is that takes a team. It takes time. It takes resources that we don't always have, either as a medical community or as a patient. We don't always have the time or the financial resources to fully address it. But yes, every day.
Every day. And I know you're in primary care. Katiushka, you're more in a specialty setting. Are you seeing a connection um, with mental health and some of the patient presentations? And would you be able to share an example or a story?
Yes, it does. I can tell you that, sometimes, for example, a person has PTSD, and it comes that anniversary of the reason for the cause of the PTSD. You can tell that what I manage as a chronic condition, goes the other way, and if a patient shares that with you, then you start being proactive and say, well, just remember, have you talked to your therapist? Are you talking to your your family? Do you take a medication? What are you doing to take care of yourself? Because I had to say, we're getting to that anniversary or time that you had an event that causes PTSD, and then I know because I know you for 5 years that when we get to that point, everything goes the other way. So that way I say, it's not that you're not gonna go through it, It's just I want you to be aware that this is happening every time you have these events, so that way you can prepare and you can see that what's happening, is affecting your other conditions, how you manage them. So just be aware that this is sometimes it's temporary, and then you go back up again. I always call it the up and downs. We all have them. So just to make sure when you're down, to let me know whether you cannot come up. Then I can find help with another healthcare provider to help you with that.
Thank you. And thank you for sharing that. One of the things I want to just ask oftentimes we're finding there's a lot of stigma around mental health, behavioral health issues, concerns. And we know people are coming into primary care and to specialty health settings with these mental health issues. Do you think patients with limited English proficiency are having a more challenging time talking about the mental health issues?
Yes, and I think and it makes sense that as soon as you are more layers and layers, already it's hard enough to come in to a medical visit, and then to have to make another appointment and then figure out insurance and how do you even see a mental health specialist. So there are multiple barriers there. There's already the inherent barrier in a lot of cultures to seeing with meeting with a mental health professional. Then often you have transportation barriers, then you have financial barriers. I don't know, like, who takes my insurance, and and
That's when you text Kim and say, Kim, do you know
Kim,
anybody in
do
the
you take.
community that takes
Okay, so
this insurance? And then
note
she tells you a whole list of
note
them.
to
That's what
self.
Katushka does.
That is what I will also do. Um, but then, so even language is one, but there are so many other barriers, and that's why I think an integrated model it just makes so much sense in every setting. But for sure, I'm biased in the primary care setting because it helps overcome a lot of those barriers, at least initially. and and definitely. But yes, language is a big one. Culture is a big one. But transportation and finances are big ones. And
Social determinants of health, I'm sure, are big,
yeah,
make contributions as well as to struggling
yeah.
with accessing
And
the
once
medical
you,
help.
you know, once they add up to the point that okay, well, people are just not gonna get that care.
One of the things that also helps to break the barrier for the stigma is when you start explaining to patients, depression is a chronic condition, PTSD is a chronic condition, bipolar is a chronic condition. So, what do you do when you have hypertension? You take a medication, you do
Mm-hmm.
this and you do that. So, it's the same thing when you are, for example, bipolar or schizophrenia. So, I think if you start educating them, that is just another chronic condition that you have, you just had to treat it to keep doing what you need to do or what you want to do. So I think the perception might change, on the patient, especially in the family. This is just,
So education,
yeah,
letting the patient
yeah,
know.
it's just another chronic condition. Doesn't define you, again, it's not who you are. You have a chronic condition. So I think that helps to break that barrier, So most likely family can support, and when you bring the topic of how about seeing a therapist, how about seeing a psychiatrist, it's a little bit more welcome, when you explain that way.
Thank you both for talking about just the mental health issues and how they intersect with chronic conditions and or symptoms. Want to ask if you've had experiences in your setting where you've used an interpreter, maybe for a patient that didn't. Heard you say there's lots of different people from different countries that are coming in. And what was the experience like having to use the interpreter?
I mean, I can speak to. I mean, but honestly, going back more to a community clinic, a lot of Marshallese patients, and they're such fun people. All my Marshallese patients, I remember. But yeah, using an interpreter, it's hard. It is hard because you're trying to convey. Or interpreters were excellent, but you're trying to convey information, and you say it, and the interpreter will do a great job and say it back. Then you have to wait to the patient to internalize that and then say it back to the interpreter, who then says it back to you, and then you go, oh, okay. I would say it works well, and all the things we talked about nonverbal communication, and they apply, and I'm able to see how I had great rapport with patients. I think for the most part we understood treatment plans and what we were talking about, but it adds layers of complexity. There's no question about it, and it is more challenging for sure. But even then, it's fun to see, just to learn a few Marshallese phrases and be able to say them. It's fun. I mean, I guess it's a different experience. It can be a fun experience, not necessarily stressful.
There you go. I hear you saying initially it's hard. However, it's fun and it gives us an opportunity to learn a little bit more about people, to see the human side, as Katiushka talked about earlier, to listen to them with more than our ears, to help peel back the layers of complexity that they're bringing in, because there are lots of different layers to health care barriers, not just language. Language happens to be the one that we're talking about today as our topic, but I heard you talk about the financial issues, cultural issues, transportation issues, spiritual issues, um, all those different pieces. So one of the things I think is important and might be a good note for us to, I have to say, I've learned a lot today talking to you guys, and I have had the pleasure. I have the pleasure of knowing you prior to today's interview. Didn't mention earlier, but worked with both of you in a primary care clinic setting, and we worked oftentimes with patients that were not native English speakers. And so know that you all bring a lot of experience, not just personal experience, but experience working with different patient populations. My big takeaway for today is no matter what language we speak, the universal language is compassion, empathy, caring. Learned it's essential that we don't just listen to someone with our ears, but we listen to them with our eyes, with our nonverbals, with our body language, with our tone, and realize that healthcare is complex. And so language and culture can be a piece of that, but there's a lot of other factors that are involved. And so I just want to say I'm so grateful that we have you two healthcare providers in our community, because you are providing that type of care, and um, you're listening with more than your ears, and you're meeting the patients where they are, and you're helping them unpack all of the different types of health symptoms they're bringing in, as well as other symptoms. So thank you for the work you do, and thank you for your time today.
You're
Thank
welcome.
you.
Thank you for having us.
Yeah, thank you.
Thanks again for listening today. We just want to remind you this is a new podcast, so please hit subscribe. If you heard anything that you were interested in or want more information on, please drop us a comment. Any suggestions for new podcasts, we'd love to hear from you. We'd love to keep you engaged. Please don't forget, if you're interested in CEUs, there's information at the end of this podcast, and you'll be able to use that link to access your CEUs. We want to thank you again for your time. I've really had a lot of fun today getting to talk to Carlos and Katiutschka, and look forward to seeing you on future podcasts.